It is 7:01 at the end of a 12-hour shift, and you're heading out to meet your best friend for dinner. As you are leaving, a resident asks if you will help him find his book. Scanning the hallway, you do not see any other staff available to help. You have a few choices. You could just let the resident know that the next available staff will help him. You know that this might upset the resident, but you just want to end your day and move on. Or you could offer to take him to his room to help him find his book. You take the time to consider this decision carefully, and as you rush out the door, you choose to stop and help the resident, even though you're running late. While you are doing this, the next shift walks onto the floor. In this moment, you took the opportunity to be an informal leader and set an example of the quality of care expected at this facility. Let's take a closer look at what leadership really means. A formal leader is someone who's given leadership based on their position within a group. They're actually assigned to be leaders as part of their role in the group. For example, at a healthcare facility, this could be a nurse floor manager. An informal leader is someone who does not have the official authority to direct a group. However, due to their actions, the group chooses to follow the lead of this person. Everyone can choose to be a leader. Let's revisit our example. You chose to stop and help a resident even though you were in a rush. This example might help people consider why they chose to work in the healthcare field in the first place. Is it to help people? Is it to connect? Someone who is really thinking about their contribution to their field and their work is called an inspired leader. Let's take a closer look. This circle represents your job. You often know what you do at your job, and most of the time you know how to do your job. But the real question we need to ask is why we do our job. So, what does this mean to you in your work? Well, let's look at how an inspired leader might approach a situation. An inspired leader needs to give a resident a bath. So, what are they doing? Cleaning a resident. How are they doing it? By giving them a bed bath. But the why is the important question. Is it to adhere to a schedule and get your job done? Or is it to make a resident feel comfortable, presentable, and worthwhile? An inspired leader has the question why in mind. When we act as inspired leaders, we can create a more meaningful relationship with our patient and coworkers and ultimately create a culture of companionship and teamwork in a facility. So let's look at this question. What is an effective team? A team is a group who interacts dynamically, has a common patient-centered goal, has been assigned specific task, and has specialized and complementary skills. Let's take a look at an example. What does all this look like in a healthcare setting? You have a resident who needs pain medication and physical therapy after a tough fall. The physician who is treating this patient will write a prescription and it will be sent to the pharmacist who will fill it. The prescription will be administered by a nurse. You will work with that nurse and the rest of this team to make sure the resident gets care. The physical therapist is another very important part of this team. You and your fellow CNAs will be a vital part of this resident's recovery. Being part of an effective team can be incredibly rewarding. Let's look at the outcomes of successful teamwork. High quality of care is provided to all patients. Conflicts are addressed constructively. Changes in the resident's condition are communicated with the team, and team members respect and listen to one another. Now let's review. Leadership includes informal and inspired leaders, asking the question why, being part of an effective team, and knowing you can have a positive impact in your work.